So we have here an expert in the house, Jochebed Isaacs, a program director of early autism, to share her expertise on how to identify signs of autism in children. Good morning, Jochebed. Nice to have you here on Bella.
Thank you so much.
So we in the society understand a little bit about what autism is. We know that, when children exhibit neurodevelopmental disorders in the way they behave, they socialize, and they communicate, now these could be signs of autism. We know also that autism is very difficult to give a proper diagnosis. It may take a long time. Usually they exhibit between, 2 to 3 years old, but you're saying that we can identify early signs?
Yep, that's right. I think some of the key indicators or red flag behaviors will be if the child is not pointing to show interest. Usually one of the key red flags will be if the child's not making words or sounds, not responding to their name, not showing interest in other children at a very early age. So some parents will even notice that the child is not following those developmental milestones as early as 6 months, 8 months. But to give an accurate diagnosis based on the US criteria, you can diagnose as early as 18 months or 2 years old.
Okay,
yeah.
So there is no way we can help the child before 18 months or 2 years old?
There are quite a few things you can do intentionally. So if a new parent realizes that my child is not responding as much as I would like him or her to do, parents could start to have very intentional playtimes with their child. So maybe doing specific repeated words or singing, cutting out screen time, which we suggest don't have screen time for at least 18 months to 2 years old. Children don't have to be watching TV or even on the iPad so early, because there is studies and research that show that that can contribute to speech delay or can contribute to low attention in children. So there's those simple things that parents can start to do. Start singing a lot of songs, start interacting, engaging. Don't allow a child to play on their own in a kind of stereotyped or repetitive way for a long time. If you notice that your child keeps doing that, try and engage him, try and interact with your child. You can do that right from the start.
Okay, so for parents who see these early warning signs where the child does not respond, does not establish eye contact, right? Or is there any other signs in terms of sensory stimuli? Like, I was reading that children with autism usually are very sensitive towards sounds, and they may start, just closing off their ears and sometimes even screaming to shut out those annoying sounds.
Well, earlier you mentioned about how challenging it is to do a proper diagnosis of children with autism, and that is true. You do need to be a trained clinician, a clinical psychologist, a developmental pediatrician. You need to take 2 to 3 hours, a thorough historic interview with the parents, observation of the child, interacting with the child. You actually need to follow criteria. We use the Diagnostic Statistical Manual, version 5, which is on our website, autismmalaysia.com. All the criteria is there, but we just advise parents, please don't diagnose yourselves. Please go to a trained clinician to actually follow that, which is the golden standard. But basically, it categorizes autism by 2 main symptoms. The first is a delay in social interaction and social communication. So what you mentioned, maybe lack of eye contact, lack of interest in peers. There are 3 subcategories there. But in the second criteria is anything that's repetitive or restricted, whether that's behaviors, interests, and under that, one of the subsymptoms is this extreme sensitivity to sensory areas. It could be sound, it could be touch, it could be light, it could be even oral motor sensitivity. So that is part of the autism spectrum.
Right. What is this oral motor sensitivity?
Well, some children may be either undersensitive or oversensitive. So maybe they don't want to put food in their mouth, or they don't have feeling in their mouth. So that could be something, and you see that probably with children who refuse to let parents brush their teeth or refuse to take different types of foods, or very sensitive if you change the milk. Or you change even the French fries, or you change the rice. They want to eat a certain type of food and only that exact food. So even if you change the label, it may be very difficult for that child.
Right.
Yeah.
Okay. Now, you're saying 18 months. Is this the golden standard in terms of time to get your child, if you feel concerned, to get him or her a proper diagnosis? Can it be any earlier?
Earlier would be harder. I mean, in the US, some clinics actually do diagnose even at 8 months or 10 months. But because, let's say, if we go back to the example you mentioned earlier, Lisa, about the sound, very young babies do get triggered by sound. I have a 1-year-old myself, and if you suddenly turn on the vacuum, she will scream, but she knows it's the vacuum. So it's a bit hard to go based on those symptoms. But I think what is probably critical is if parents notice the red flags. On our website, we have all the red flags. We also have a checklist that parents can fill out themselves called the MChat. Okay. And if they feel that their child is meeting those criteria, there's a score at the end and advice if you should go and see a professional. So if families feel like they are really concerned about their child as early as a year or 14 months, just go and see their pediatrician. It's better to take some action than not. I think the challenge in Malaysia is sometimes, I think more children maybe go undiagnosed or maybe like some clinicians, if they're not trained, they may say, oh, I think it's fine, I think, don't worry so much. Yes, and they might brush it off. And then sometimes if we are first-time parents, we have no one to compare our child to, so we think, yeah, maybe it's fine. And then sometimes, you know, well-meaning friends or family say, oh, even your father was like that, or even your husband was like that. He only spoke at 5.
They were a little slow in talking or walking. Okay.
That's right. So sometimes people, and then also, as a new parent itself, it's not easy. I mean, it's you don't want this to be the reality at all. Yes. But I think the point is that if there is early diagnosis, there is evidence-based research treatment that really, really works. So what we do is applied behavioral analyses, and that's proven to be effective in treating children with autism. But because autism is a spectrum, so different children progress differently. But our research shows 48% of children are able to catch up to be like typical children, and that's a huge you know, possibility and potential that a child diagnosed at 18 months or 2 years or 3 years, depending where they are on the spectrum, depending on the service they receive, could catch up and go to school and be like everybody else, live a meaningful life. And it's so well researched that in the US, 38 of their states provide funding for this treatment. At least 3 years of fully funded one-to-one ABA service for children on the spectrum.
Right. Yeah. So now we know that for parents as well, it's a very lengthy process to ascertain a proper diagnosis, because you're saying, you know, autism is a spectrum and no two children are the same on that spectrum, right?
Yeah. So you do need, I think for parents probably the most challenging is who to contact and where do we get started. So we've actually tried to put as much information on our website so new parents can just go and read up everything that they need to. So we explain actually what you need to expect from someone who is giving you the diagnosis. So we basically say it should be 2 to 3 hours long. They should be using a DSM-5, the type of professionals that should be doing the diagnosis. So we try to discourage parents from getting a diagnosis over a couple of minutes. Sometimes a well-meaning school teacher says, I think your child, I think this has autism.
Wow.
And it's very painful as a new parent, like, oh, what?
Yes.
Like, where did that come from? How can you say that? So it's different if, I think, well-meaning friends or teachers could say, hey, your child is demonstrating some red flags. Your child's not really progressing in certain areas. Do you want to go and see someone and get that diagnosis? From the point of actually meeting the right professional, it can take 2 to 3 hours. If they're good professional, they'll explain to you the symptoms really well. We really take our time to explain the symptoms, go over it with the parents, so it also brings some kind of closure to their journey.
Right.
And then advise parents on the stages of grief that you will be going through. Because parents need to know that if it is autism, this is a lifelong journey. And we need to help parents be mentally prepared, emotionally prepared for that.
Now, I was reading for other countries. They say the proper diagnosis may take perhaps about, 6 months to a year, but you're saying in 2 to 3 hours, well, experts can provide a proper diagnosis.
Definitely.
Okay.
I mean, if they want, in some countries, they may insist that you also have an IQ assessment to go together.
Yes.
So the reason why it could take longer is because of the multi-level professionals that are involved. So maybe I would meet the child and do the first diagnostic evaluation, and then somebody else would do the IQ developmental assessment. So that is a like a multi-leveled assessment, which of course is even better. But if you do not have that opportunity, a really good professional can give you that. And of course, parents may want to have a second opinion, which we encourage as well. You know, in countries like Singapore, they use the Autism Diagnostic Observation Schedule, ADOS, and that is the golden standard tool as well, together with the DSM-5 to actually do a proper diagnosis. So those two together, DSM-5 and ADOS, is what we would recommend,
Right, so there are different programs to diagnose. Now,
different
finally,
tools,
different tools. Before you go, Jochebed, for children, you know, I think parents that I met, they start off with different types of life skills, and one aspect that they begin with is food, diet. Now, I know that parents also have this special diet for a child with autism. So, you know, it's usually organic or very highly nutritious food. Now, would you, is that something that has proven to be effective?
Well, to be honest, it is quite varied, the experience that parents have. At this point, there isn't enough research to show the effectiveness of it in comparison to treatments like ABA, behavioral-based treatment. Some parents, I think, see some changes. I think if children have digestive problems, a change in diet will definitely help. But whether it actually changes the brain development and all, there's no evidence for that. Whether it triggers a child to speak, there's no evidence, because a lot of children who are on this diet are also doing behavioral therapy at the same time. But as a parent, I do feel a nutritious diet is absolutely important. So we should stay away from junk food. A lot of sugar is not encouraged. Home-cooked food, organic food, vegetables, stay away from, you know, basic things that are not healthy, for the children. I think that's wise for any child, not just with autism.
Thank you so much, Jochebed Isaacs, now Program Director of Early Autism. We're going to take a quick break. When we come back, we're going to be talking to parents with children living with autism.
In 88 children these days are affected by autism. Autism is a neurological disorder that presents itself by showing two symptoms that are 1. Deficits in social communication and social interaction. 2. Restricted repetitive patterns of behaviors, interests, and activities. Children would normally show signs of autism as early as 12 months to 18 months of age, where they might have problems with eye contact, not responding to their name, and poor skills in pretend play and imitation. The condition of children with autism worsens when they start to have more frequent tantrums, to the point where they may cause self-injury or become violent.